What's up, my MS family? How are you guys doing today? Today is day 9 of my surgery. I didn't do a video yesterday because it wasn't anything too eventful that happened. Kind of felt a little fatigued, no energy. But other than that, I was okay. No issues going to the bathroom. Today, well, yesterday as well, I had a little discomfort walking, and I'm going to assume because if you remember from my other video, I said that I had went to the doctor and I thought I was urinating blood. Well, come to find out, I busted a stitch trying to urinate when I went to the doctor, and I believe that's where the blood came from. And I feel the stitch hanging. I'm not going to pull it. Doctor closed at 12 on yesterday, so I was not able to get in touch with anyone. So on Monday, I will give them a call, see what they say, but I'm just leaving it as is. I'm not going to try to pull, tug, cut, do anything on my own. I can tell that a stitch has come from where it's supposed to be. You know, when I put my topical cream on there, I can feel that one is not where it was before. So that would probably explain the issues of urinating blood, but it doesn't explain my lower abdominal, lower back pains and issues with my my bladder, kidney, wherever the pain is coming from. Also, you know why? Well, I'm gonna assume they're gonna tell me that, you know, because I had surgery on the 13th, I may still have some issues with urinating, starting to urinate, and also emptying my bladder. It's you know, I had a little issue with it before surgery because of the MS, but now it's worse than before. I will address that with my doctor when I go next week. I have a few appointments. As far as bowel movements, they've been fine. I haven't taken any stool softeners nor like the Miralax for the past few days, and what I've noticed is my bowels are starting to, or my intestines are starting to get back to normal, where, you know, I'm passing gas normally. I'm not passing gas and pooping or anything like that. You know, everything is kind of going back to how it was before surgery, which means for me, because I had my gallbladder taken out, I'm back to the constant diarrhea. Now, it is more than normal. I don't know if it's because of, you know, my procedure and my stomach is just not taking what it normally took, because today I've lost count. I may have already been to the bathroom at least 5 times today so far, and my stomach is still acting a fool, and it was like that yesterday as well. So pretty much whatever I'm eating, you know, it's not staying in, so I'm not getting any nutritional value at all for these past few days. So I can only assume when I go back to the doctor again, I will have lost more weight, which again, like I said, normally I'll be happy, but under these conditions, you know, I've already lost a little over 30 pounds. I can definitely tell, you know, in this area here, you know, when I look at prior videos or pictures. As far as my diet, I mean, you know, when it comes to the losing the weight, you know, I've done the bland diet. I've followed the instructions there. And because I was losing weight, I was like, oh, well, let me pack on the pounds, the calories, I should say. Of course, that didn't help. I still lost. Between the time I went to my primary physician before versus a few days ago, I had already lost 9 pounds, so, scratch that idea, just to eat whatever. So tomorrow I will go back to what I've been doing before, and just to let you know why I'm concerned is that over the years I've done many diets, been in the gym. I've actually, per my doctor, they did all my testing and checked my heart and everything and made sure I was cleared to get on the drug called phentermine. And phentermine is 37.5 milligrams. And what it does is it curbs your appetite. It also speeds up your metabolism, and it aids in losing weight along with exercise. And really, you don't even have to exercise and you lose weight, and it makes you drink more water as well. And I had, I used to take these pills, and I would go to the gym and exercise, and I can promise you I didn't lose weight this quickly going to the gym and taking these meds, so I don't know, what the problem is. My theory, is, I could have Crohn's disease because, my bowels are always irritated for whatever reason. And when I eat, my stomach is bloated. And, I'm gassy and all some other things that's going on. So I will talk to my gastro about that and my family doctor about that as well. But as far as, the hemorrhoid and fissure surgery, still don't regret it, because I promise you, going to the bathroom has been a dream compared to before. And I will take the no pain, and I will, deal with the diarrhea for now. Now, what I did notice today, I went out to, do a little grocery shopping and get a few things that I need. I wasn't out long, and what I have noticed is that anytime I have to poop, I feel the pressure, and I'm going to assume because that's still, I'm going through the healing process with the surgery. And anytime I have to go to the bathroom, I feel that pressure just steady. It kind of like a pulling pressure, not a hurting thing, but it is a pulling pressure. It's uncomfortable to walk, knowing that you have to go to the bathroom, and that's what it is. Another thing I've noticed is that I take water pills because of issues with swelling and my heart issues. And, normally I'm going to the bathroom. I have to pee. And that has slowed down. So I don't know if I should be concerned about that or not. And I still notice that when I have to go to the bathroom, sometimes I have to lean over to my left in order just to get the urine to flow. Another concern of mine as well. I've been asked about the vaccine. I haven't taken it yet, the COVID vaccine, and I haven't taken it because it seems like every time I get over one infection, I have another. No, the vaccine is not a live virus. I know that. But I just don't want to aggravate anything additional in my body, because, they don't know all they need to know about this virus. About this vaccine. And it takes years in order for them to really study and know for sure, not all of the side effects, but a lot of the side effects that may happen, in patients that have pre-existing conditions, like MS, cancer, leukemia, lupus, whatever, that's out there. People can say what they want to say, but my thing is, you do you and let me do me, because I'm the one that knows my body. And, you know, a lot of people will try to talk you into doing things when, you know, God has put something in you to say, well, you know, let me hold off for a minute. And a lot of times that voice that's telling you to hold off is for a reason. And I don't know, you know, and we don't always know what that reason is when we hear that little voice say, well, hold on, wait a minute, and let me not do it. And you have that hesitation. You know, there's a reason you have a hesitation. And a lot of times we don't listen to that voice. And when we don't listen, then we get into some trouble. So until I can, you know, shake whatever's going on here, I'm not gonna concern myself with it so much. I will talk to my PCP and my neurologist next week about, you know, taking it, their thoughts, concerns, etc. You know, they're supposed to be the experts. You know, I could do my research as well about it, but then I will let you guys know what they say about the shot, at least pertaining to me. Also, I will keep you guys updated as far as, you know, my results from, you know, the tissue samples that they took when they did my surgery as well. Again, like I said, just still a little weak. I'm still using, I use the cream. Again, I don't do the sitz baths because of my issues with constant UTIs. I do still use my squirt bottle, which has been working fantastic. I still use my creams. I use my pain meds, and it's not because of the surgery. I don't know what, you know, again, I will have to update you guys because I'm getting a lot of cramping and a lot of issues with stomach aches. And again, this is something I've been dealing with before surgery, so I'm not going to connect that to the surgery itself. I've had some intestinal issues before, and, you know, when you tell the doctors, they seem to want to overlook it, and they're not, you know, too concerned. And a lot of times doctors are not real concerned until the worst happens. And, you know, you can tell them until you're blue in the face, and they still don't listen because, of course, they went to school, they have the degrees, and they think they know more than you. But in reality, the person that's telling you going to know more about what's going on with their body. They may not have a medical term to attach to it, but they can tell you the signs and the symptoms, and, you know, that should prompt you to go over the list of possibilities of things that could be going on with the body, so that you can see what's going on with your patient. Of course, that would be for a perfect world, and we're not in one. So, but as of now, things are great. I still would recommend the surgery. And again, if you guys have any questions or concerns, definitely feel free to ask. And I will respond. And I'm trying to think of, I can't think of anything that will cause me to regret having this surgery, period. So, it has been amazing for me, honestly. And once I get some updates on some other things that's going on, then I will let you guys know. Once I have my follow-up with my surgery, I will periodically update you guys on, you know, what's going on. And then I'll go back to my videos with my MS, because it's a lot of things that, you know, I need to cover that pertains to me, and maybe you guys are going through as well. And there's another number one biggie that I'm having an issue with as well that may plague other folks as well. So I will let you guys know. I will keep you guys posted wherever you are in the world. I hope you have a good morning, good afternoon, good evening. Until I speak with you soon, I hope you have a good day.